A couple of themes that we're focusing on and investing in 2015 with regard to healthcare. We're really concentrating on this movement away from care being delivered inside of institutions, inside of ambulatory practices, to this expanding new greenfield we believe is the new point of care where people live, work, and play. We're seeing some evidence of that being validated through the CMS's new CPT code 99490 for chronic care management. And so we're beginning to see the push out of the distribution of care to provider extenders and other services, technology-enabled services. So that's a key area for us.
In our practice, the changing models of healthcare reimbursement and payment models are dramatically changing what our clients are doing today. The systems are quickly gearing themselves to payment for quality, ACOs, all various forms. They're very interested in adapting to those models, and our smaller healthcare clients are finding it very challenging at times to adapt to these. So we have larger systems putting new plans in place and smaller systems trying to figure out what they're going to do in the future. In terms of young companies positioning themselves for growth, main thing in my mind in Nashville, we have a community that's amazingly receptive to networking, to working with others. So really finding other companies that are in adjacent areas or have capabilities that are relevant to your company, going out and networking. People are very open in this community to helping each other, and so really tapping into all the different pieces that are represented in Nashville is what I would highly advise.
So in terms of the themes we're investing behind, obviously the key thing that we look for in healthcare are companies that are taking costs out of the system by delivering highest quality care. And that can take the form of many things, from enabling more efficient drug distribution to delivering care in a lower cost setting. The big themes we're spending time on right now, and we are thematic investors because we believe that healthcare is a constantly changing industry that's driven, and that evolution is driven by specific trends at any given point in time. The key trends we're investing behind right now are around consumerism, cost containment, and care coordination. So right now is an interesting time in healthcare. As you noted, there's a lot of change in terms of how the payment structures are working. And I've been investing in healthcare for over 20 years, and I think now is the time that has seen the most robust change. A lot of that's driven by the reform bill from a couple of years ago, but a lot of the change is actually happening in the private and commercial markets as well. So what we see happening is a shift away from the fee-for-service model towards more pay for value or pay for performance. That involves capitated payments and bundled payments. So what we're seeing is providers who've typically operated in a very fragmented environment that is well suited to a fee-for-service model are having to combine and aggregate together. So that's driving a lot of vertical and horizontal consolidation. You're seeing hospitals trying to get bigger in markets. You're seeing them try to have a more diverse array of services and develop post-acute capabilities to enable them to take care of patients once they leave the hospital.